everyone, this is Hillary, the Nurse Preceptor. It's good to see you. I want to remind you, please pick up a copy of my book, You're on Your Own, Preparing for the Impending Healthcare Crisis. I'm not sure it's impending anymore. I think the crisis is starting. So since I'm like the bad news bears, let me read you off a few things that I have looked up that are new as of this week. So these are drug shortages. So the FDA right now is saying that we have 124 drugs in short supply, and that's as of September 14th. And I got the updated list off of the ASHP.org. That's the American Society of Hospital Pharmacists. They have an updated list of drug shortages that they maintain, and they also put reasons for the shortages along with it. So to summarize, it was 21 screens of medication, and it was probably about 10 medications or so per screen. So we have saline in all different sizes, including the big bags of saline and the little saline pushes. Dextrose injection, 10%, 25%, 50%. That's important if you're someone who's diabetic, who's hypoglycemic. You know, it's what we give to give them a little bit of extra sugar. We have albuterol. So if you're on nebulizers, it's the nebulizer solution that you put in the nebulizer machine. Racemic epinephrine, which is also known as Xopenex. It's one of the quick-acting inhalers that people use when they're having an asthma attack. That's not good. A lot of antibiotics on the list. Many. I didn't even list them all. Amphetamine salts. So all the ADHD kids are probably going to need to consider looking at another medication to replace the Adderall or the Adderall XL or XR or whatever they call it. Anyway, we need to probably be thinking, if you're a parent of a kid who's on one of these medications that's in short supply, get what you can prescribed and get it filled quickly before it all runs out, and maybe be having conversations with your doctor going forward that if this becomes a prolonged short supply and you're unable to get it, are there any things that you can give them in its place, like any replacement medications? Okay, emergency cardiac drugs. Oh my goodness, this is really not good. Atropine, which is injectable, they use that in the event where you have a slow heart rate to get it sped back up to a good level. We've got dopamine and dobutamine, which are in infusions that are used in shock and heart failure, respectively. IV Lasix, it's a potent diuretic. We used it all the time in the hospital. It's on short supply right now. We also are short on epinephrine auto injectors. That would be things like your EpiPen, although I don't know what brand name is on short supply right now. Anesthetic agents, many of them, including xylocaine and lidocaine. Those would be things that they use to numb you for things like dental procedures, surgeries, spinal blockades, also like epidurals if you're having childbirth or a C-section. Several different types of steroid medications, sedatives, more than a few. Many injectable drugs. I don't know if this is an issue with increased usage, if it is a systems process issue, or if it is like where they're missing parts or they're missing some of the manufacturing capabilities. I don't really know. Heparin, blood thinner, yeah, it's on short supply. And then iodine contrast. Some of the different contrasts that are used when you're in the hospital and you are getting something like let's say like a cardiac stress test. So those are all very important things. I noticed that the most common thing that I saw as far as a cause was increased demand for the drugs. Are people sicker than they were a year ago? I'm just kind of curious what would have precipitated this sudden increase in demand. Okay, just saying. All right, I've got more in the next video. Stay tuned. Like, share, subscribe.